as the country commemorates Youth Day today, we look at the health challenges facing our young people. Issues including access to basic health care, mental health struggles, and now the COVID-19 pandemic, to name just a few. They continue to affect the lives of our young people. So let's bring into the discussion the Deputy Health Minister, Dr. Sibongiseni Dhlomo, joins us via our video link this morning. Dr. Dhlomo, we've got so much to talk about in terms of the particular health challenges that face the youth, but perhaps since it is Youth Day today, shall we kick off with a question around where you were today, sir, on this day in 1976, and what you remember?
Yes, I was in a high school. Thank you very much, and good morning to all your viewers. I was in a high school on Mpangeni, next to University of Zululand at that time, where I was actually doing my what we call now grade 10 before I moved on to complete there. We started by seeing something that was happening at the University of Zululand, the burning of the institution. So we didn't know what was happening. Only then, when the day unfolded, we came to hear about a very big program in the country, started in Soweto and spreading countrywide. So that is where one was in 1976, June 16.
Wow. Well, it's incredible, and I'm sure you've got several recollections about the days that followed. But let's go to our conversation, Dr. Dhlomo, the particular health challenges that face our young people in South Africa. And in your department's own sort of outline of how you plan to address these health challenges, you've also singled out the 10 to 14 years age group and the 15 to 19-year-olds, specifically insofar as new HIV incidence is concerned. Tell us more.
Thank you very much. We actually are saying the youth of 2022 are facing different challenges than those that were faced by the youth of 1976. What could be our contribution as health in terms of alleviating some of those challenges? We therefore wanted to accept and give the benefit of doubt to South African citizens that yes, indeed, our health services are not very friendly to young people. And therefore, what can we do? We then launched a program that is focusing just on adolescent health, which is adolescent youth user-friendly services, where we are saying, what can we do in our facilities to really have these programs? We then, in the country, have 1,200 of our health facilities, clinics, that have already moved into what we call a launching of a youth zone. In Willowvale here in Mbashe municipality yesterday, as I'm still in Mthatha, we were launching one of those programs within what we call a youth zone. What does that mean? It means in that facility there is a nurse who is now trained to support programs of young people. When they come in there, they are prioritized. Usually they come in the afternoon. Young people saying, I am now sexually active, but I want to pass my matric before I fall pregnant or I make somebody pregnant. What can I do? We prioritize them without judging them, assist them with family planning advices and programs. And young people who also would say, I have had a mistake, I am now pregnant, I don't want, this is an unplanned pregnancy, what can you assist me going forward? Then we have bring programs related to that. Yes, a lot of young people, especially when they go to universities, there is a mental health problems there, challenges. We also come in there supported by Higher Health, where we work with the Deputy Minister Manamela to say this is a place where we want to encourage them and say we have done well up to here. What can we do to support you to graduate alive by giving you lessons, support on here I am now sexually active, I don't want to get HIV infections, what do we do? So, you know, these are programs that are targeting young people, but a significant number of them are not yet HIV positive to date. They don't have sexually transmitted infections, but if we don't focus on them as a high-risk group, many more of them will then fall into the program. So that is why we intensify to say there's an investment by your family, by the country. We would want to see you living a long and healthy life to 70 years. What can we do to make sure that that life is protected, and this is our contribution that we can do as health.
So Dr. Dhlomo, it's over 1,200 youth zones that you've now created in our public health facilities, and it's across the country to openly discuss issues affecting young people, for young people to feel free, that they can go to their healthcare facilities and ask for this kind of advice. It's certainly a welcome move, Dr. Dhlomo, and I don't want to take away from that. But the question always is, you know, why has it taken us so long to tailor our healthcare response specifically to young people?
Look, it has come in through advices from young people to say, you know, if you put me in the queue there with my grandmother, my mother, and I come in here, and also you are helping healthcare workers who are judgmental, they ask me, you want to come in for family planning advices, let's go and call your pastor, your grandmother. Now, I mean, it has taken hours to be educated through those experiences of young people. Yes, we can actually say it has taken long, but it is a program that we created based on those issues. I mean, we are better than not having it. Yes, we want to accelerate. I'm happy in the Eastern Cape where I am, of the 1,219 of those health facilities with the youth zone programs, 400 are in this province. So we need to accelerate, especially in the most rural, most conservative areas where mothers, children can't be in one queue and the child is coming in there to say, I am 13 years old, I would like to be supported because I don't want to fall pregnant. Everybody gets scared and they start shouting. Now we want to move away from those attitudes. And we are winning. And the young people yesterday were telling us that they do see the results and they must accelerate this program elsewhere. So yes, I admit it might have taken long, but at least we have started now.
Yeah. You know, my colleague Ayanda is out in Soweto this morning, and someone that he spoke to on the show earlier this morning is talking to us about the cost of safety, the economic cost of safety and the impact on young people. I suppose as we speak this morning, Dr. Dhlomo, we can also reflect on the cost of a lack of proper health care for our young people, and how that impacts them for the remainder of their lives.
The most important one, there's also a part that we are dealing with where young people say, I know you are dealing with the termination of pregnancy free of charge, but I prefer not to come to your facilities because you are unfriendly, you are judgmental, and I'm not sure whether my information is going to be confidential. Now, we are launching a program of that type of magnitude to say, let us not be judgmental. This young person says, this is unplanned, I want to continue with my life and go to matric without this pregnancy. How do you assist me to terminate? So we want to actually be there for them so that they don't go to the backstreet abortions because a lot of them do die. You cannot guarantee safety of this process if it is done in the backstreet with the people who have not trained to really do a termination of pregnancy. So you are right. The more we improve quickly on our attitude, the more we can actually guarantee safety of our young people in accessing even sexual reproductive health.
Dr. Sibongiseni Dhlomo, the Deputy Health Minister, let me thank you for your time this morning. A special angle on this Youth Day, the Health Department announcing those 1,200 youth zones that have now been set up in our public health facilities across the country. Dr. Dhlomo, thanks once again.